Morning, everyone. We're a minute late getting started. Sorry about that. Welcome to the Public Health Committee meeting. Are you all ready to start? Everyone ready? I see thumbs up. Ready on the right, ready on the left? Stand up, sit down. No. Okay. Welcome, everyone. Ready to get started. Senator Anwar.
Thank you so much. Just wanted everybody to know where the exits are. And if you feel too cold over here, it's warmer outside.
Thank you. Representative Clara DeStitria.
Thank you, Madam Chair. Let's get going.
Great. Thank you so much. Okay. The first item on our agenda is Senate Bill, item number 1, Senate Bill number 1324, an act authorizing emergency medical services personnel to administer glucagon nasal powder. This is a JF to the floor. May I have a motion?
So moved.
Moved by Senator Anwar, seconded by Representative Clara DeStitria. This bill does, just as the title says, allows trained EMTs and paramedics to administer glucagon nasal powder, requires these providers to receive training from the organization designated by the Department of Public Health, and it also allows ambulances to carry glucagon nasal powder. Is there discussion? Rep. Clara DeStitria.
Thank you, Madam Chair. I'd like to start a consent calendar and I'd like to put this item on it.
Thank you. Remind me from our attorneys, do we need a motion for that consent calendar, or can we wait until the end? Okay.
Madam Chair, I'd like to make a motion to start a consent calendar and put SB 1324 on the consent calendar.
Thank you, Representative Clara DeStitria, for that motion. Is there a second on the motion? Seconded by Representative Zupkis. So item number 1 will be moved to consent. We will vote on the consent calendar at the end of the meeting. And speaking of the end of the meeting, our meeting will end, or our votes will have to close when session begins at noon. So just a reminder for that. Item number 2, Senate Bill number 1394. This is an act concerning the provision of healthcare services to inmates in correctional institutions. This is a JFS to the floor. It's LCO 5901. May I have a motion?
So moved.
Moved by Senator Anwar. Is there a second?
Second.
Seconded by Representative Belton. This bill requires the Department of Public Health, in conjunction with the Department of Corrections, to annually evaluate the provision of healthcare services, including mental health care for incarcerated persons, to determine whether best practices as designated by a nationally recognized commission are being utilized. It requires the correction ombudsperson to determine and report the number of personnel required to provide appropriate care to incarcerated people, as well as inform family members regarding health care and available remedies. It establishes a task force to examine recruitment and retention of healthcare workers in the department, and it requires the Department of Correction commissioners to report to the committee regarding the provision of healthcare services, communication with outside providers, while a person is incarcerated, and the ability for a provider to obtain medical records and information from the time when a patient was incarcerated. The S language, which I mentioned some of the pieces in my summary, it specifically adds mental health, as we heard in testimony, in addition to healthcare. It adds the Department of Mental Health and Addiction Services Commissioner to the task force, and it adds language requiring a look at the National Commissioner Association for the identification of best practices. Is there discussion on this item? Representative D'Amico.
So thank you, Madam Chair. I appreciate the fact that the S language contains those provisions that were asked for during the public hearing. I'm just curious, is there a reason why that specific National Commission on Correctional Health Care was not mentioned specifically?
Thank you for the question, Rep. D'Amico. It's my understanding that generally in the drafting conventions, we don't necessarily refer to a specific body, and thus that's how our attorneys put it in there. So it's anticipated that that's a likely option, but there are multiple options, so that's why it's drafted that way.
So just one other question. It was suggested during the public hearing, there was an organization that has some expertise in this field. I know, again, you don't want to mention them in the bill necessarily, but is there provision in the substitute language to call upon the services of any private organizations, or did I miss that somewhere in the language?
It doesn't explicitly outline that, but it's not precluded at all in the language as it's written.
It is not precluded.
Correct.
Great. Thank you. Thank you.
Thank you, Representative. Representative Clara DeStitria.
Thank you, Madam Chair. I'd like to add this item to the consent calendar.
Thank you, Representative. Item number 2, Senate Bill number 1394 will be added to our consent calendar. Next on the agenda, we have item number 3, House Bill number 6834. This is an act concerning the Department of Mental Health and Addiction Services recommendations regarding various revisions to mental health and addiction services statutes. This is a JFS, which is different than what you have on your agenda. This is JFS LCO number 5923. And I'll go through the sections and then clarify the S language. Sections 1 and 2 of this bill make changes to the payment process for the pretrial intervention program that the department has. This makes the department the payer of last resort and first bills insurance. DEMIS will continue to cover costs for those who are unable to pay for these required services. Sections 3 to 11 make changes from the language substance abuse to substance use. The department is asking us to move to recovery-friendly language, really in an effort to reduce stigma, encourage and support recovery, moving us away from shame and blame and into treatment and support frameworks. Section 12 updates the membership of the Opioid Settlement Advisory Council. Last year, we added 2 positions from legislative members. This evens it out as is required per the settlement to add those 2 municipal members to correct that imbalance. Sections 13 to 17 change the definition of opioid. This is done to match an updated federal definition and allows then the prescription of medication, including buprenorphine, via telehealth. So this will help assure and increase access to care. The S language simply adds the words covered benefits in sections 1 and 2. And this is to clarify that when insurance has a covered benefit, that is the payment. So that's the only change in the S language. Is there discussion on this item? Representative D'Amico.
Just for clarity, is there S language? Because on the agenda, it just says JF. So I'm confused.
Yes, as I mentioned a moment ago, the agenda says JF.
Oh, I'm sorry.
No, it's okay. I'll just clarify again. After the publication of the agenda and in communication with our team, we realized that there had been a request from an organization and the Department of Mental Health and Addiction Services to just add those 2 words. And because it was a simple addition, we did seek to make that change. If you give me just one moment. And I've been reminded that I need a motion on this
I
item.
just text Peter too.
Thank you. So moved by Senator Anwar, seconded by Rep. Clara DeStitria. I got ahead of myself. Thank you for the reminder. This is a team effort. So speaking of that team effort, back to the discussion, Rep. D'Amico. So yes, we did have S language, which you should have received. It is LCO 5923. So now that we have a motion after we were discussing, is there any other further discussion? No. Representative Clara DeStitria.
Madam Chair, I'd like to add this item to the consent calendar.
Thank you very much, Representative. So item number 3, House Bill number 6834, LCO 5923 will be added to our consent calendar. Next, we have item number 4, House Bill number 6903. This is an act establishing a pilot program to disseminate information concerning child care services, early intervention programs, and financial assistance programs to patients receiving prenatal care. This is a JF to the floor. May I have a motion? Moved by Senator Anwar and seconded Representative Kitt. So this bill actually comes to us referred from the Children's Committee. This was unanimously voted on from out of that committee. And what the bill will do is it will ask the Office of Early Childhood and DSS, the Department of Social Services, to develop a one-year pilot program in 5 hospitals in the state to disseminate information to those who are receiving prenatal care in hospitals. And this would include childcare opportunities, early intervention, and financial assistance opportunities for expectant mothers. So the Office of Early Childhood will compile and distribute that information to the hospitals. They'll also administer a survey to parents and submit a report to the Children's Committee on the efficacy of the pilot program. I will note that I had to be reminded we don't see these referrals as much as we used to, and the Children's Committee did refer this here because obviously this is through a hospital. They've asked for our support to pass this on and continue negotiation of this bill. It's my understanding that there will be some continued negotiations, as you may have seen, probably reflected in testimony. Is there discussion on the item? Representative Clara DeStitria.
Thank you, Madam Chair. I know I have some concerns about this. I know OEC mentioned that they don't have the staff or the funds for this. And OEC also mentioned that Commissioner Bai was concerned that this is overlapping some of their current programs. So I think more discussion needs to happen with what this bill really does and what we need to do moving forward. Thank you, Madam Chair.
Thank you very much. And yes, I would note that one of those programs this committee supported, the Family Bridge program. So it's one of those that was mentioned, and agree that and have understood that there will be further discussion. Is there further discussion here at the committee? Seeing and hearing none, Madam Administrator, would you kindly call the roll?
Senator Anwar,
Senator Anwar votes yes.
Representative McCarthy Vahey,
McCarthy Vahey votes yes.
Representative Belton,
Belton votes yes.
Senator Marks,
Marks votes yes.
Senator McCrory, Senator Summers, Representative Clara DeStitria,
Representative Claire DeStitria votes no to flag.
Representative Berger-Shivalo,
Berger-Javala votes yes.
Representative Biggins,
Biggins votes yes.
Representative Carpino,
Representative Carpino votes no.
Representative Dauphiné,
Dauphiné votes no.
Representative D'Amico,
D'Amico votes yes.
Representative Elliott, Representative Django,
Yes.
Representative Gilchrist,
Yes.
Representative Senator Gordon,
Senator Gordon votes yes.
Senator Hockedal, Representative Cabras de Graw, Representative Kidd,
Representative Kidd votes yes.
Representative Kennedy,
Kennedy votes no.
Senator Kushner, Representative Morrow,
Mara votes no.
Representative Parker, Representative Maureen Bello,
Maureen Bello votes yes.
Representative Paletto, Senator Rahman, Representative Reddington Hughes,
Reddington Hughes votes no.
Representative Ryan,
Representative Ryan votes yes.
Representative Steinberg,
Representative Steinberg votes yes.
Senator Slapp,
Senator Slapp votes yes.
Representative Zupkis,
Zupkis votes no.
Senator McCrory, Senator Summers, Representative Elliott, Senator Hockedal, Representative Cabras de Graw,
Cavros DeGraw votes yes.
Representative Paleto, Senator Rahman, Representative Reddington Hughes. Thank you, Madam Chair.
No.
Was that Representative Reddington Hughes?
Yes, I'm sorry. I voted before, but I will vote again, no.
Thank you. Thank you, Madam Chair.
Thank you, Madam Administrator. So moving on to item number 5, House Bill number 6919. This is an act requiring newborn screening for Duchenne muscular dystrophy. This is a JF to the floor. May I have a motion? Moved by Representative Berger Javallo, seconded by Representative Mara. So this bill has come to us actually at the request of many members of this committee, and thanks to the advocacy. This will add, beginning July 1st, 2027, the Duchenne muscular dystrophy to the newborn screening panel. And the cost will be about $660,000, though we don't have a specific outline in the bill. Is there discussion on this item? Representative Berger Javallo.
Thank you, Madam Chair. I promise not to prolong this meeting. I just want to say that if we are able to move this out of committee and this does become something that we can look at collectively as two chambers, I would implore everyone to read the testimony from the families who are advocating for this. In particular, my own constituents, the Curran family, could not attend the hearing because they were away. But I would definitely encourage you to read. They're very moving, but also very factual testimony about how this will help so many. So thank you very much, Madam Chair. I appreciate the
Thank you,
opportunity.
Representative. Representative Mara.
Thank you so much. Thank you for bringing this bill forward, and thank you everyone for the support that they've had for this bill. I agree that the testimonies were, if you read them, are very compelling, but I would also like to add fiscally that this also just makes sense. I know DPH has some numbers out there, but if we look at the long-term prognosis of these children and catching them early, fiscally, it makes sense as well. So this is a good bill, and I hope it makes it through this year. Thank you so much.
Thank you, Representative. Seeing no further discussion, Representative Clara DeStitra.
Madam Chair, I'd like to add this item to the consent calendar.
Thank you. Item number 5, House Bill number 6919 will be added to our consent calendar. Next, we go on to item number 6. This is House Bill number 6920, an act concerning patient-specific emergency medical care protocols for persons with a rare disease or special health care needs. This is a JF to the floor. May I have a motion? Moved by Senator Anwar. Second. Is there a second? Seconded by Representative Felton. Is there discussion on this item? Senator Gordon.
Thank you, Madam Chair. When it comes to people who have rare diseases, I certainly understand a need to make certain that people can be provided in emergency situations with appropriate protocols. I just have a few concerns. One is a significant liability concern to those who take care of people in the emergency departments, because the reading of this talks about, quote, shall adhere to any patient-specific emergency medical care protocol, end quotes. And as we know in the world of medicine, not everything is black and white, and there's situations, many times, you have to individualize care depending upon what an emergency might be. And an emergency could sometimes be compound a rare disease event with something else that's going on. So I just want to make certain that we're not unnecessarily going to cause problems for those who are going to take care of people with rare diseases. I actually have and continue to take care of some people with rare diseases in my world of being a blood and cancer specialist. But sometimes certain protocols do have to, I wouldn't say be deviated, they have to be individualized, case by case, sometimes hour to hour. So I'm just concerned when we talk about shall adhere and what a liability might be. For example, if someone comes in with a rare disease and an emergency room physician is assessing and feels, well, there's something additional that needs to be done for very good medical reasons, but isn't adhering to a very specific emergency medical care protocol, is there a liability there? So for that reason, I'm going to end up voting no on this with to flag it, even though I very much support what we can do for those who have rare diseases. And I really hope that we can look to change the wording to get to the goal of what this is trying to do, but not tie the hands for medical care that needs to be done for people on an individualized basis. Thank you.
Thank you for your comments, Senator Gordon, and also for helping us realize what the bill does, because I neglected to share. So I appreciate that. Is there further discussion on this item? Representative Carpino.
Thank you, Madam Chair. I'd like to add similar concerns. Having dear friends who are members of this community, I understand how important that a specialized care is for them, but I do have concerns with the language, particularly since those protocols are written at one point, and in the event that they are seeking medical treatment, that is a completely separate moment in time. So I'm hopeful that the language will change, and I'm happy to add my assistance if it is so welcomed. I think perhaps better language in a perfect world, and we have till June, maybe shall take into consideration. But for today, I cannot support it.
Thank you, Representative Carpino. Representative Clara DeStitria.
Thank you, Madam Chair. And to add upon what my colleagues have said, the hospitals are concerned that this is going to make an already chaotic situation more chaotic. So I'm hoping we could work with the language in this bill, because I think it's important for our rare disease population to have some assistance. Excuse me, also in the rare disease population, if someone's going into the ED, they could have their primary care call the ED and let them know that they have this patient coming in, so they can start that dialogue before they even land in the ED. So maybe we can avoid some of the issues that the rare disease people are having. Thank you, Madam Chair.
Thank you very much, Representative Clara DeStitria. Representative Zupkis.
Thank you, Madam Chair. I agree with my colleagues. I am going to be a yes today. However, that doesn't mean on the floor. So I am hopeful that y'all will do some work to make this where it could be a definite yes for everybody. Thank you.
Thank you, Representative Zupkis. Representative Kennedy.
Thank you, Madam Chair. I come from this on the opposite way, and this bill is very important to anyone who suffers with rare disease bills, but it does still need work. And I hope that we will accomplish that. I would have liked to have this been a JFS today, but it's not. I will support the bill today, and with the hope that the changes and the concerns that we have are addressed by the time it gets to the floor. So thank you, Madam Chair.
Thank you very much. And I appreciate the comments today. We certainly are going to remain in conversation. I think all of us share the goal of assuring that those who suffer with and struggle with rare diseases and special health conditions have the support and care they need, but we need to balance those concerns. So we will certainly remain in conversation, both with the advocates and with our provider community. Seeing no further discussion, Madam Administrator, would you kindly call the roll?
Senator Anwar,
Senator Anwar votes yes.
Representative McCarthy-Vahey,
McCarthy-Vahey votes yes.
Representative Belton,
Belton votes yes.
Senator Marks,
Marks votes yes.
Senator McCrory, Senator Summers, Representative Clara DeStitria,
Representative Claire DeStitria votes yes.
Representative Berger-Givallo,
Berger-Givallo votes yes.
Representative Biggins,
Biggins votes yes.
Representative Carpino,
Carpino votes no.
Representative Dauphiné,
Dauphiné votes no.
Representative D'Amico,
D'Amico votes yes.
Representative Elliott, Representative Django,
Yes.
Representative Django, Representative Gilchrist,
Yes.
Senator Gordon,
No.
Senator Huckadell, Representative Cavros-DeGraw,
Cavros-DeGraw votes yes.
Representative Kitt,
Representative Kitt votes yes.
Representative Kennedy,
Kennedy votes yes.
Senator Kushner, Representative Morrow,
Mara votes yes.
Representative Parker, Representative Moore Bello,
Moore Bello votes yes.
Representative Paletto, Senator Rahman, Representative Reddington Hughes,
Reddington Hughes votes no.
Representative Ryan,
Representative Ryan votes yes.
Representative Steinberg,
Representative Steinberg votes yes.
Senator Slabb, Representative Zupkis.
Zupkis votes yes.
Thank you, Madam Chair.
Thank you very much, Madam Administrator. Moving on to item number 7 on our agenda. This is House Bill number 6974. This is an act concerning the use of funds in the Tobacco Settlement Fund. This is a JFS to the floor. It is LCO number 5438. This bill will require $32 million from, let me back up. May I have a motion? Thank you, Senator Anwar. Is there a second? Seconded, Representative Belton. I'm just, barreling through today. Forgive me. So this bill, back to what the bill does. This bill will require that $32 million from the tobacco settlement funds be dispersed to the Tobacco and Health Trust Fund. This is the CDC recommended amount for Connecticut and is $20 million higher than what is in the current proposed budget from the governor. In 26-27, Connecticut is poised to collect well over $300 million in annual revenues, both between our tobacco taxes and from settlement monies. And tobacco marketing in Connecticut alone is about $60 million annually. Our young people's use of combustible cigarettes has declined, but the use of vaping and newer products like Zyn is on the increase. Our numbers at high school tobacco use rates are about 13%. So the Tobacco and Health Trust Fund has begun the process of funding those CDC best practices, including a $2 million funding of the Quit line. And I think you all know what I'm about to do is give a little public health announcement. If you, like 2/3 of the people who currently smoke, would like to quit, that number is 1-800-QUIT-NOW, and you can enroll online. The S language, it updates the dates to reflect the proper fiscal year. Is there discussion on this item? Senator Gordon.
Thank you, Madam Chair. And I just want to say I strongly support moving from 12 million to 32 million, as you said. The CDC does advise it, and for very good reason. So I strongly support the bill. Thank you.
Thank you very much, Senator Gordon. Representative, let me just look this way first. Representative Clara DeStitria.
Thank you, Madam Chair. I'd like to add this item to the consent calendar.
Seeing and hearing no objection, item number 7, House Bill number 6974 will be added to our consent calendar. Moving on to item number 8, House Bill number 6975. This is an act requiring a biennial study of payment parity for services under certain individual and group health insurance policies in the state and the Husky Health Program. This is a JF to the floor. May I have a motion? Moved by Senator Anwar. Is there a second? Seconded by Representative Belton. This requires that every 2 years, the Office of Health Strategy study whether payment parity exists between providers of mental health care and those providing health care. It ensures, as one testifier has put it, that ongoing transparent data collection to track trends, identify persistent disparities, and enforce accountability will occur. OHS published a report in 2024 showing that 4 insurers in Connecticut are showing warning signs for noncompliance with reimbursement rates below benchmark rates, and ongoing reports would provide transparency and elucidate those trends. Is there discussion on this item? Seeing and hearing none, Representative Clara DeStitria.
Madam Chair, I'd like to add this item to the consent calendar.
If there is no objection, item number 8, House Bill number 6975, JF, will be added to our consent calendar. Next, we have item number 9. This is House Bill number 6976, an act concerning the Department of Public Health's recommendations regarding hospital emergency department diversion. This is a JF to the floor. May I have a motion?
So moved.
Moved by Senator Anwar. Is there a second? seconded by Representative Berger Gervalo. This bill, it requires the Department of Public Health to develop emergency department diversion requirements and also for hospitals to develop their own ED diversion policies in accordance with such requirements. The Department of Public Health shall adopt regulations and in the interim may adopt policies and procedures. This bill also provides an enforcement mechanism for hospitals who do not comply. Is there a discussion on this item? Representative Clarice Tetria to be followed by Senator Gordon.
Thank you, Madam Chair. We have some concerns on this bill. We did pass a bill last year, I believe it was SB 81, that's requiring hospitals to do some data collection already for the state of Connecticut. Excuse me. So I would just like to see that data come through and run that, and before we're adding more on the plate of hospitals that we require them every year to do more and more. So hopefully that will be a consideration that we can do moving forward with this bill. Thank you, Madam Chair.
Thank you very much, Representative. Senator Gordon.
Thank you, Madam Chair. And I just want to highlight that we did receive the testimony from the Association of Connecticut Ambulance Providers and from the Connecticut Hospital Association, both raising valid concerns. And I just have concerns about what DPH may want to promulgate because there's already various federal rules and EMTALA rules and other things pertaining to diversion, emergency medical care, things like that. So I'm just concerned about really what may end up happening with DPH on this. And I think it's more realistic and would be better to have DPH continue to work with those who are dealing with issues in the emergency departments and those who are transporting patients to emergency departments, such as our ambulance personnel and EMTs, before wanting to delve more into getting more reports and things like that. It just seems to me that it's putting the cart before the horse in an already burdened situation in emergency rooms. So I do have concerns relative to this, and I think things could certainly be reworked better or let current things that are already happening be sorted through a little bit more so we have a better handle on what really then should be done. But again, hospitals already have various criteria that they use when to divert, especially when not to divert. And I'm just concerned what this may tag hospitals with. Thank you.
Thank you, Senator Gordon. Is there further discussion on this item? I do believe we will remain in discussion with the department and with hospitals on this item as it moves forward. Seeing and hearing no further discussion, Madam Administrator, would you kindly call the roll?
Senator Anwar,
Senator Anwar votes yes.
Representative McCarthy Vehy,
McCarthy Vehy votes yes.
Representative Belton,
Belton votes yes.
Senator Marks,
Votes yes.
Senator McCrory, Senator Summers, Representative Clarice Tetria,
Clarice Tetria votes no.
Representative Berger Gervalo,
Berger Gervalo votes yes.
Representative Biggins,
Biggins votes yes.
Representative Carpino,
Carpino votes no.
Representative Dauphiné,
Dauphiné votes no.
Representative D'Amico,
D'Amico votes yes.
Representative Elliott, Representative Django,
Yes.
Representative Gilchrist,
Yes.
Senator Gordon,
No.
Senator Huckadell, Representative Cavers DeGraw, Representative,
Cavros DeGraw votes yes.
thank you. Representative Kitt,
Representative Kitt votes yes.
Representative Kennedy,
Kennedy votes no.
Senator Kushner, Representative Morrow,
Mara votes no.
Senator Martinez, Representative Martinez, I'm sorry.
Representative Martinez votes yes.
Representative Parker, Representative Morin Bello,
Morin Bello votes yes.
Representative Paletto, Senator Rahman, Representative Reddington Hughes,
Reddington Hughes votes no.
Representative Ryan,
Representative Ryan votes yes.
Representative Steinberg,
Representative Steinberg votes yes.
Senator Slapp, Representative Zupkis.
Zupkis votes no.
Thank you, Madam Chair.
Thank you very much, Madam Administrator. Moving on, we're going to item number 10, House Bill number 6978. This is an act concerning the Department of Public Health's recommendations regarding various revisions to the public health statutes. This is a JF to the floor. May I have a motion? Moved by Representative Belton. May I have a second? Seconded by Representative Gilchrist. This bill is a number of various revisions, as the title says. First, and probably the one we've talked about the most, is to allow the Rare Disease Advisory Council to apply for and accept grants and raise funds. The sections 2 through 4 will allow the Maternal Mortality Review Committee to share their findings with Vital Records. In section 5, this will streamline inspections, facility inspection operations, and particularly if the facility has maintained federal certification. Section 6 clarifies the Department of Public Health's authority to be able to distribute federal grants to nonprofit and local health partners. Section 7 streamlines the hearings for the Board of Examiners for nursing. It clarifies that a hearing can be carried out by a hearing officer. Section 8 expands the provisions on facility discipline to apply to all of Chapter 19A. And finally, Section 9 is truly a statutory citation correction. Is there discussion on this item? Representative Clara DeStitria.
Thank you, Madam Chair. One of my concerns is the section that expands DPH.
Oh, we had a motion and a second. Nope, that's okay. You're
Okay.
I'll go back to you, Rep. Clara DeStitria.
Thank you. I'm concerned about DPH's expanded authority in this bill, and it's specifically from just currently Chapter 368V, the healthcare institutions, and now it's to the entirety of 19A. I will be a no today to flag this. I just want to dig deeper into why this is happening, and hopefully we'll see this move forward. Thank you, Madam Chair.
Thank you very much, Representative Clara DeStitria. And certainly we will be talking with the department about many of our bills, and we will add this to our list to do so. Is there further discussion on this item? Seeing and hearing none, Madam Administrator, would you kindly call the roll?
Senator Anwar,
Senator Anwar votes yes.
Representative McCarthy Vehy,
McCarthy Vehy votes yes.
Representative Belton,
Belton votes yes.
Senator Marks,
Marks votes yes.
Senator McCrory, Senator Summers, Representative Clara DeStitria,
Clara DeStitria votes no.
Representative Berger-Givallo,
Berger-Givallo votes yes.
Representative Biggins,
Biggins votes yes.
Representative Carpino,
Carpino votes no.
Representative Dauphiné,
Dauphiné votes no.
Representative D'Amico,
D'Amico votes yes.
Representative Elliott, Representative Django,
Yes.
Representative Gilchrist,
Yes.
Senator Gordon,
No.
Senator Huckadell, Representative Cavers DeGraw,
Cavers DeGraw votes yes.
Representative Kitt,
Representative Kitt votes yes.
Representative Kennedy,
Kennedy votes no.
Senator Kushner,
Senator Kushner, there you go, unmute yourself.
Thank you. Senator Kushner votes yes.
Representative Morrow,
Mara votes no.
Representative Martinez,
Representative Martinez votes yes.
Representative Parker, Representative Morin Bello,
Morin Bello votes yes.
Representative Paletto, Senator Rahman, Representative Reddington Hughes,
Reddington Hughes votes no.
Representative Ryan,
Votes yes.
Representative Steinberg,
Representative Steinberg votes yes.
Senator Slapp, Representative Zupkis.
Zupkis votes no.
Thank you, Madam Chair.
Thank you, Madam Administrator. Moving on to item number 11 on the agenda, House Bill number 6979. This is an act concerning the Department of Public Health's recommendations regarding physician recruitment. This is a JF to the floor. May I have a motion?
So moved.
Moved by Senator Anwar. Is there a second? Seconded by Representative Belton. This bill, which comes to us from the department, creates a retired physician license, which allows retired physicians to practice pro bono. It lowers the costs for that licensure and allows physicians who have had lapsed licenses to obtain retired license status. It also allows primary care providers to also practice behavioral health in nonprofit settings. It additionally reinstates a student loan program run by the department for primary care and behavioral health professionals. Is there discussion on this item? Representative Zupkis.
Thank you, Madam Chair. I have a couple of questions. I know this it suggests a repayment program. I understand there is a shortage of physicians, there's a shortage of teachers, paras, all the committees I sit on, quite honestly. But for this repayment program, two questions. How much is it? How much is it to go to for them for a student loan? And how much would they be repaid? What's the cost of a program that they would go through?
Thank you very much, Representative Zupkis, for that very good question that I don't have an answer to today. And I will add that we also, as a committee, will be hearing a workforce bill that will have some items in terms of student loans, reimbursement, et cetera. I'll note that the Appropriations Committee is actually doing or has looked at a bill to do a study of all of the different programs. The Higher Education Committee also has a bill. There are a number. This bill in particular is reinstating a program that would look at potentially federal dollars if available with a potential state match, but I don't have an answer to your question. And I do think it's something that we will need to dive into in more detail as we also hear our future bill as well.
Thank you, Madam Chair. And also, I tend to not be a fan of free or paybacks unless it really has some meat to it. And so what is the meat to this? If somebody goes and gets a repayment on their loan, what are they accountable for?
Thank you, Representative. Did I hear you correctly? You said unless there is a need to it, is that?
Meat.
Oh, a
like
meat.
teeth to it. That
Gotcha.
They have
Meat.
to
Thank
have
you.
a certain GPA or they, well, I think a lot of things, but I'm just curious for this to get a repayment, what is the meat, the teeth to it that holds them accountable?
Again, I'm short on some of the details of that, and probably in part because I do believe that we will have to have a broader conversation about all of the different items. And I know that's not what's properly before us today. This was something I think that we essentially accidentally repealed last year. The department's looking to have this back in place as a mechanism. We know from our work with some of our task forces that we approved last year that there are a number of different shortage areas, but we haven't looked at the specifics of what those metrics are. So we will have to continue that conversation.
Thank you. And again, I understand there's a shortage of doctors, but a shortage of teachers, paras, a lot of things. So I will be a no today to flag this. I will be interested as to those two questions and the answers to those. Thank you.
Thank you very much. I think we now have a running list for the Department of Public Health from today's meeting. So we'll add that to our list. Thank you for that. Senator Gordon.
Yes, thank you, Madam Chair. I'll be very brief. Other states do have various criteria for loan repayments, things like that. I know I submitted a bill relative to health care professionals, just not doctors, modeled on what Massachusetts does and has various criteria about how long you'll work in the state, whether you're going to work in a rural area or in an underserved area, underserved specialty, things like that. So I do think there's ways we can model workforce development in the healthcare profession in a broad way, depending upon how much it may cost, but also borrowing in a good way with what some states are already doing. And not have to recreate the wheel. So I will support this, but I do think, I do agree we do need to flesh some things out, and I look forward to being of help in that regard. Thank you.
Thank you very much, Senator Gordon. And I should clarify, the department very well may have, especially having done this previously, and I'm sure does have some fleshed out details. I just don't have them with me today. And my apologies to the ranking member, Representative Claritas DiTria.
Okay, thank you, Madam Chair. Also, I wish that part on the appropriations part with the loan repayment wasn't in this, because we do have a workforce bill here in public health that will be coming forward. That seems to me like it would have been better served in that section, because as you said, this was a program that had lapsed and they're reinstating it, which I feel is important. So maybe at some point we could take this out of here and put it into our workforce bill. Thank you, Madam Chair.
Thank you very much. And I will note this is within available appropriations in the language of the bill. Representative D'Amico.
Thank you, Madam Chair. I'm hopeful that this workforce bill in this committee that was just referenced might ameliorate my concerns that I'm about to express here. So we received some testimony. One piece of testimony is from a constituent of mine who is a specialist, and he noted that that DPH convened a physician retention and recruitment working group. And one of their recommendations, this is according to him, one of their recommendations was to increase funding and eligibility for the student loan repayment program to include physicians across all specialties, particularly in high need areas. So I guess my question is, why are we, is it a financial problem or is it a philosophical problem? Why are we limiting this student loan repayment to only certain the certain areas that were outlined in Section 5?
Thank you for the question, Rep. D'Amico. Again, this was a program that the department had been using, and they were specifically targeting primary care and behavioral health. That's probably some of our foundational areas in healthcare. By reinstating this particular program, we will allow them to be eligible for receiving any available state or federal funds to continue with that those areas, which I think is, again, I would suggest are some of our foundational areas. We do, as I mentioned, have other bills that will allow us to talk a little bit more about some of those specialized areas where we know that there are shortages. We have a lot of data from that, thanks to the good work from our many volunteers who have sat on those workforces and working groups.
So I appreciate that. And if I may, just wondering, is this anticipated workforce bill that's upcoming, it's going to include specialties, hopefully, and it's going to include APRNs and RNs and PAs, perhaps?
I don't have the language before me today. So we will, but certainly we'll probably have a broad range of testimony, even with whatever the language is. But today, for this bill and for the purposes of this vote, this is solely focused on primary care and behavioral health providers. Is there further, you good, Representative D'Amico? Okay, thank you. Is there further discussion on this item? Let me check online. If not, Madam Administrator, would you kindly call the roll?
Senator Anwar,
Senator Anwar votes yes.
Representative McCarthy Vehy,
McCarthy Vehy votes yes.
Representative Belton,
Belton votes yes.
Senator Marks,
Senator Marks votes yes.
Senator McCrory, Senator Summers, Representative Claritas DiTria,
Claritas DiTria votes no.
Representative Berger-Givallo,
Berger-Givallo votes yes.
Representative Biggins,
Biggins votes yes.
Representative Carpino,
Carpino votes yes.
Representative Dauphiné,
Dauphiné votes no.
Representative D'Amico,
D'Amico votes yes.
Representative Elliott, Representative Django,
Yes.
Representative Gilchrist,
Yes.
Senator Gordon,
Yes.
Senator Huckadell,
Senator Huckadell votes yes.
Representative Cavers DeGraw,
Cavers DeGraw votes yes.
Representative Kitt,
Representative Kitt votes yes.
Representative Kennedy,
Kennedy votes yes.
Senator Kushner,
Senator Kushner votes yes.
Representative Mara,
Mara votes no.
Representative Martinez,
Representative Martinez votes yes.
Representative Parker, Representative Moran Bello,
Yes.
Aye.
Representative Paletto, Senator Rahman, Representative Reddington Hughes,
Reddington Hughes votes no.
Representative Ryan,
Votes yes.
Representative Steinberg,
Representative Steinberg votes yes.
Senator Slapp, Representative Zupkis.
Zupkis votes no.
Thank you, Madam Chair.
Madam Administrator, I believe Rep. Paletta is available. If, I think he was there.
Representative Paletto,
And I apologize for that. I just pulled in. I'm parked. Representative Paletta votes no. Thank you.
thank you. Thank you, Madam Chair.
Thank you so much, Madam Administrator. Next on our agenda is item number 12, House Bill 6980, an act concerning recommendations of the Legislative Commissioner's Office regarding technical revisions to public health statutes. This is a JF to the floor. May I have a motion? Moved by Rep. Gilchrist. Is there a second? Seconded by Representative Kitt. This is exactly what the title says. It is simply technical revisions and language changes, which I confirmed again this morning with our LCO attorneys. Is there a discussion on the item? Representative Clara DeStitria.
Madam Chair, I'd like to add this item to the consent calendar.
Seeing and hearing no objection, item number 12, House Bill 6980 will be added to our consent calendar. Next, we have item 13, House Bill number 7048, an act concerning the Office of Health Strategy's recommendations regarding revisions to the Healthcare Cabinet. This is a JF to the floor. May I have a motion? Moved by Rep. Gilchrist. Is there a second? Seconded by Representative Biggins. Thanks, Rep. Biggins. This bill will make changes to the appointment authority and membership of the Healthcare Cabinet, which is an advisory body to the governor within the Office of Health Strategy. Is there discussion on the item? Senator Gordon.
Thank you, Madam Chair. I have one question about this when I'm trying to do the math. Is this actually going to create one more voting position on this? That's one of the concerns I have if we're adding more to it. And the other concern I have and why I'm going to vote no on this is that it gives 2 appointments to the Commissioner of Health Strategy, which I don't think is a good thing to do. For that reason, I'm going to vote no, but I just raised the question about if the net number of voting members increases by 1 is what I think it might do, but I'm always happy to be corrected if needed. Thank you.
Thank you for the question, Senator Gordon. I'm chuckling at myself because last night I was thinking, oh, I'm probably going to get asked that, and I didn't do the math. I believe that you are correct, but I am not certain. I will trust your math and understand that I hear your concerns as well in terms of the appointments. And if we have further discussion, I may be able to confirm that. Representative Zupkis.
Thank you. It just says it allocates 5, and when you count, there's 6.
Okay, thank you for that, Representative Zupkis. I'm going to have to confirm the numbers here, and I'm not doing very well on the fly with that. But understand that there are concerns and noted. Is there further discussion? Representative D'Amico.
If it helps you in your calculations, Madam Chair, I believe line 9 refers to 7 appointments. So if that
That's
helps.
very helpful, Rep. D'Amico. Clearly, we will have more conversation on this item before us to clarify and confirm how those appointments should go. I think I will note that the nonprofit appointment, I think, was supported by the Alliance as well. Senator Anwar.
And we'll count the votes on this one too.
Is there further discussion? Seeing and hearing none, Madam Administrator, would you kindly call the roll?
Senator Anwar,
Senator Anwar votes yes.
Representative McCarthy Vehy,
McCarthy Vehy votes yes.
Representative Belton,
Belton votes yes.
Senator Marks,
Marks votes yes.
Senator McCory.
Senator McCory votes yes.
Thank you, sir. Senator Summers, Representative Clarice Dietrich,
Clarice Dietrich votes no.
Representative Berger Javallo,
Berger Javallo votes yes.
Representative Biggins,
Biggins votes yes.
Representative Carpino,
Carpino votes no.
Representative Dauphiné,
Dauphiné votes no.
Representative D'Amico,
D'Amico votes yes.
Representative Elliott, Representative Django,
Yes.
Representative Gilchrist,
Yes.
Senator Gordon,
No.
Senator Huckadell,
Hockadel's a yes.
Representative Cavus DeGraw,
Cavus DeGraw, yes. Cavus DeGraw, yes.
thank you. Representative Kitt,
Representative Kitt votes yes.
Representative Kennedy,
Kennedy votes no.
Senator Kushner,
Senator Kushner votes yes.
Representative Morrow,
Mara votes no.
Representative Martinez,
Representative Martinez votes yes.
Representative Parker, Representative Morin Bello,
Yes.
Representative Paletto, Senator Rahman,
Paletta votes no.
thank you. Senator Rahman, Representative Redmond Hughes,
Reddington Hughes votes no.
Representative Ryan,
Votes yes.
Representative Steinberg,
Representative Steinberg votes yes.
Senator Slabb, Representative Zupkis.
Zupkis votes no.
Thank you, Madam Chair.
Thank you, Madam Administrator. Did you get Rep. Elliott's vote?
No, I did not. Is he in the room?
Yes, he is.
Representative Elliott,
You have to press the button.
Yes.
thank you.
There you go. Thank you very much, Madam Administrator. Next on our agenda is item 14, House Bill number 7049. This is an act concerning the recommendations of the Office of the Child Care Advocate regarding oversight of children's autism spectrum disorder services and the Infant Mortality Review Program. This is a JFS to the floor, LCO 5888. May I have a motion? Moved by Rep. Belton and seconded by Representative Kitt. And this S language essentially eliminates sections 1 through 5 of the bill regarding the behavioral analysts. And it will allow, what it does continue to do is to allow disclosure of confidential data related to infant mortality review between the Department of Public Health and the Office of the Child Advocate. Is there discussion on this item? Representative Clarice Dietrich.
Madam Chair, I'd like to add this item to the consent calendar.
Thank you very much. And seeing and hearing no objection, item number 14, House Bill 7049 will be added to our consent calendar. Next, item number 15, this is House Bill number 7081, an act concerning licensure portability for marriage and family therapists. This is a JFS to the floor, LCO 5438. May I have a motion? Moved by Representative Belton, seconded by Representative Biggins. This S language, oh, forgive me, hang on one second. Can I just get a clarification from our attorneys that I gave the correct LCO number?
5891.
Thank you for the clarification and correction, Senator Anwar. So that is actually LCO 5891. So I am corrected. The S language will, did I move in second? Yes, we had a motion from Rep. Belton and a second from Rep. Higgins. That's okay. The S language essentially provides that licensure portability for fully licensed marriage and family therapists versus those in the probationary period. Is there discussion on the item? Representative Clara DeStitria.
Madam Chair, I'd like to add this to the consent calendar.
Seeing and hearing no objection, item 15, House Bill number 7081, JFS to the floor, will be added to the consent calendar. With that, we will now go back to vote on our consent calendar, which has been properly moved and seconded. Okay, I will read the items on our consent calendar. Item number 1, Senate Bill 1324, an act authorizing emergency medical services personnel to administer glucagon nasal powder. This is a JF to the floor. Item number 2, Senate Bill 1394, an act concerning the provision of healthcare services to inmates in correctional institutions. JFS LCO 5901. Item 3, House Bill 6834, an act concerning the Department of Mental Health and Addiction Services recommendations regarding various revisions to mental health and addiction services statutes, JFS LCO 5923. Item number 5, House Bill 6919, an act requiring newborn screening for Duchenne muscular dystrophy. This is a JF to the floor. Item 7, House Bill number 6974, an act concerning the use of funds in the Tobacco Settlement Fund, JFS to the floor, LCO 5438. Item 8, House Bill number 6975, an act requiring a biennial study of payment parity for services under certain individual and group health insurance policies in the state and the Husky Health Program. This is a JF to the floor. Item 12, House Bill 6980, an act concerning recommendations of the Legislative Commissioner's Office regarding technical revisions to public health statutes. This is a JF to the floor. Item 14, House Bill number 7049, an act concerning recommendations of the Office of the Child Advocate regarding oversight of children's autism spectrum disorder services and the maternal and the infant mortality review program. This is JFS to the floor, LCO 5888. And finally, item 15, House Bill number 7081, an act concerning licensure portability for marriage and family therapists. This is a JFS to the floor, LCO 5891. The item has been moved and seconded. Madam Administrator, will you kindly call the roll?
Senator Anwar,
Senator Anwar votes yes.
Representative McCarthy Vehy,
McCarthy Vehy votes yes.
Representative Belton,
Belton votes yes.
Senator Marks,
Marks votes yes.
Senator McCory,
McCory's a yes.
Senator McCory, I did not see you on screen if you're not in the room.
Can you see me now?
Yes, sir, thank you.
That's a yes.
Thanks. Senator Summers,
Summers votes yes.
Representative Clara DeStitria,
Clara DeStitria votes yes.
Representative Berger Javallo,
Berger Javallo, yes.
Representative Biggins,
Biggins votes yes.
Representative Carpino,
Carpino votes yes.
Representative Dauphiné,
Dauphiné votes yes.
Representative D'Amico,
D'Amico votes yes.
Representative Elliott,
Elliott, yes.
Representative Django,
Yes.
Representative Gilchrist,
Yes.
Senator Gordon,
Yes.
Senator Hockenell,
Senator Hockenell votes yes.
Representative Cavers DeGraw,
Cavers DeGraw votes yes.
Representative Kitt,
Representative Kitt votes yes.
Representative Kennedy,
Kennedy votes yes.
Senator Kushner,
Kushner votes yes.
Representative Mara,
Mara votes yes.
Representative Martinez,
Representative Martinez votes yes.
Representative Parker, Representative Morin Bello,
Yes.
Representative Poletto,
Yes, Representative Paletta votes yes.
Senator Rahman, Representative Reddington Hughes,
Reddington Hughes votes yes.
Representative Ryan,
Votes yes.
Representative Steinberg,
Representative Steinberg votes yes.
Senator Slabb, Representative Zupkis.
Zupkis votes yes.
Thank you, Madam Chair.
Thank you. And before everyone goes, just a couple quick things. Votes will be held open until the start of session. Senator Anwar.
Thank you so much, Madam Co-Chair. I just wanted to let everybody know that many of the members are in transit and we did not have too much of a conversation and discussion on most of the bills because we were able to have them in advance. And I wanted to thank our colleagues for doing the consent calendar because I know many of the people would be voting at this time. And with the session is there, it gets tricky. We have to finish this before the session. So that's why we did not have much more conversation. Thank you.
Thank you very much for that, Senator. The next meeting will be our public hearing on Monday, March 10th at 11:30. And then we have a committee meeting on Wednesday, March 12th at 11:30. And we are in recess until the start of session. Votes will be held open here in 1E.
Yeah, I'm just gonna say feel better. I'm sorry, you feel so better.
Senator Harkadel.
Yes.
Okay, give me a minute, please. Senator Harkadel, how would you like to vote on item number 4, House Bill 6903?
Yes.
Item number 6, House Bill 6920?
Yes.
Item number 9, House Bill 6976?
Yes.
Item number 10, House Bill 6978?
Yes. Sorry.
Item number 11, House Bill 6979?
Yes.
Thank you. Those are the ones you were missing.
Thank you so much. Have a great day.
Same to you. Senator Kushner?
Yes.
Just checking to make sure I have you on consent. You're good on consent?
Yes, I did vote on consent.
Okay, how would you like to vote on item number 4, House Bill 6903?
Kushner votes yes.
Item number 6, House Bill 6920?
Yes.
Item number 9, House Bill 6976?
Yes.
Item number 10, House Bill 6978.
Yes.
You're all set, Senator.
Thanks so much. Have a good day.
Thank you. Representative Paleto?
Yes.
Okay, you are missing quite a few.
Uh-oh, I'm in trouble.
No, you're not. Okay, item number 4, House Bill 6903. How would you like to vote?
No, please.
Item number 6, House Bill 6920.
Yes.
Item number 9, House Bill 6976.
No.
Item number 10, House Bill 6978.
Yes.
Item number 11, House Bill 6979.
No on that one.
That's all for you, Representative.
And,
Thank
and
you.
I'm sorry, I did make a mistake on item number 10. Can I vote no, please?
Hold a minute, let me find that. 6978.
Yes, on item number, correct. Representative Paletta votes no.
Okay,
I
Thank you.
apologize for that. Thank you so much.
that's no problem. Thank you.
Have a great rest of your week. Bye-bye.
Same to you. Bye. Senator McCory? Senator Rahman?
I'm here. I'm sorry. I'm driving. I'm sorry,
He's back.
young lady. I am so sorry. What I miss?
Item number 4, House Bill 6903.
That's a yes.
Item number 6, House Bill 6920.
I'm a yay.
Item number 9, House Bill 6976.
Okay.
Is that a yes?
That is a affirmative. Yes, ma'am. No, that's a yes, ma'am.
Item number 10, House Bill 6978.
Yes.
Item number 13, House Bill 7048.
Yes.
Item number 11, House Bill 6979.
Yes.
You're all set, Senator.
Thank you.
You're welcome. Senator Rahman?
Yes.
Okay, item number 4 on the agenda, House Bill 6903.
Oh, yes.
Item number 6, House Bill 6920.
Yes.
Item number 9, House Bill 6976.
Yes.
Item number 10, House Bill 6978.
Yes.
Item number 11, House Bill 6979.
What is this? Yes.
And item number 13, House Bill 7048.
Yes.
Just a moment, don't go. And on consent, it's item numbers 1, 2, 3, 5, 7, 8, 12, 14, and 15. How would you like to vote on consent?
Yes.
Thank you.
Awesome. Thank you.
You're welcome. Senator Summers?
Hi there.
Hi. Okay. Item number 4, House Bill 6903.
Yes. I'm going to be yes on everything, so I'll make it easy for you.
So yes on everything.
Everything. I'm yes today.
Okay, and on consent? Yes.
Yes. I was
Oh.
there for the consent. I don't know if you saw me, but yes. Yes on everything.
Okay, great. Thank you.
Okay,
Yes, I
thanks
have
a
you
lot.
down on consent. Thanks.
Okay, bye-bye.
Bev,
Yes, Peter.
I'm missing a ton of votes, so when I come up there, please.
You're taking votes down there?
Yeah, she said room 1E. So I'm gonna stay here until session begins.
Okay. You're gonna stay?
Yeah,
So I
we're
can
only
jump off?
we're only missing Parker. I already texted him, so yeah, I'm just waiting here.
Okay, I'll jump off.
Okay. But you got everyone, right? Except Parker,
and who?
Perillo. But
I did not get a letter for Perella, but I
Yeah,
did
yeah.
not call his name. I heard he was sworn into the Senate.
That's
So
what
if
I
he's
heard too,
sworn
yeah.
into the Senate, nobody sent me anything.
Okay, all right.
So
So
I
you're
will
just missing Parker?
text him or I will check to make sure he's no longer on public health.
Okay. But you have
Okay, so I'll
but you-
jump off. I leave.
but
'Cause
you have
I-
everyone except Parker, right? Just making sure.
Okay, hold on.
Because I texted Parker. He said, "Thank you. I'll stop by one." Okay.
Elliot is also missing
Oh,
some votes.
I
Do you
have-
want to text him?
I already took him. I took him. He came in here and I
Okay.
took him.
Let me see who else. I think it's only Perella and Ryan is missing some votes.
Oh, in person I took them all. So
Okay.
they don't turn on the mic,
Just
you know, they
making
just
sure.
yell. They just yell,
And
yes.
Senator Slap?
I took him. He left for screening and he came back in and I took his vote. So yeah, I have him.
Thank you, sir.
So everyone except Parker, right?
He's on his way up here or to the room.
He
Because you
said to
announced the room,
1E.
so if he's going down to Peter, I can jump off.
No, I realize that.
I'll do whatever you want, but